So welcome everybody to today's webinar. My name is Layla Moomin and I am the Community Engagement Coordinator with the Canadian Cancer Survivor Network. Thank you for attending the first webinar in our 8-part empowerment series entitled CCSN's Remarkable Cancer Survivor's Guide to Healing and Recovery. We would like to thank the Healing and Cancer Foundation for working with us to create this webinar series. We are pleased to welcome our presenter, Dr. Rob Rutledge. He is a radiation oncologist based in Halifax, Nova Scotia, and he specializes in breast, prostate, and pediatric cancers. He is also an associate professor in the Faculty of Medicine at Dalhousie University. In 1999, Rob created the Skills for Healing Cancer Weekend Retreats. These weekend support groups teach a powerful and integrated approach to cancer diagnosis and ways to heal at levels of body, mind, and spirit. To date, over 2,000 people have attended one of 64 retreats in 30 cities across Canada and abroad. Rob is the CEO and chair of the Healing and Cancer Foundation, a registered charity that freely offers educational videos, documentaries, and live and webcasted seminars. He is the co-author of The Healing Circle, which captures the teachings and inspirational stories from the weekend retreats. Rob has received a Cancer Care Nova Scotia Award for Excellence in Patient Care, and Doctors Nova Scotia presented him with a Health Promotion Award in recognition of his contribution to physician health and health promotion in cancer patients. In today's webinar, Dr. Rutledge will teach you how to maximize your chance of recovery after a cancer diagnosis. He will also give an overview of everything you need to do to heal physically and otherwise, from getting the best care from the medical system to practicing proven mind-body techniques to nurturing a spiritual path. You will learn what remarkable cancer survivors can do to manifest health and happiness. At the end of the presentation, our speaker will answer your questions. However, at any time during the webinar, please feel free to type any questions you might have into the chat box. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you would like to learn more about CCSN, please visit our website at survivornet.ca. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. Now I will turn things over to our presenter. Welcome, Dr. Rutledge.
Thanks, Layla. What an incredible honor to be here and all the advocacy work that the Canadian Cancer Survivor Network does. And this is about empowerment. This is about making a huge difference in your health and happiness. And I'm also just really very touched by the people who have attended today. Hats off to each and every one of you, because that is very symbolic from a kind of psychic, spiritual capacity right into the mind, right into the body in terms of healing and wholeness and recovering. So really, hats off to all of you. I really feel like this presentation today is the culmination of about 35 years of really asking that question: what can people do to really make a difference in their lives? What do the remarkable cancer survivors do? How is it that each and every one of you can maximize your health and your happiness? And so in this first of 8 series, this one, if you just listen to this one, you'd probably get the whole series, but I am going to flush out each topic in the subsequent side. And then for our last one, we're really going to talk about the remarkable cancer survivors and the kind of groundbreaking work that's happening right now. So thank you all. I recommend you put your questions into the chat box and I'll address them at the end. But I wanted to start the presentation, and maybe Layla, you could have mute all except for me, be fine. So yeah, so I'll tell you the story. The story begins. I'll just we'll have a little moment there. Kayla, are you able to mute that? Mute all, and then unmute me, maybe. Great. Unmute. Great. So this story starts in the mid-1980s when I was in medical school and trying to figure out what I wanted to be, what kind of physician I wanted to be. And I read this book called Love, Medicine, and Miracles by Dr. Bernie Siegel. And it was the first taste of the attributes of the remarkable cancer survivor. So Bernie called them the exceptional cancer patients, the people that did exceptionally well, whose tumors melted away quickly with treatment, who far outlived their doctor's expectations, who got through very, very difficult treatments. People have undergone spontaneous remission. And with that first book, I knew I really wanted to be an oncologist and to run support groups and really make a difference in people's life at this kind of psychological and spiritual level. But Bernie was talking about his exceptional patients. I don't like the word exceptional because I think we all can be exceptional in some way or form. And a few of the attributes that he talked about, and this is the paradox here, is that his exceptional patients no longer viewed recurrence of cancer or even death as a failure. Right. So even though I'd like each and every one of you to do really well, right, in terms of either cure or great longevity, the remarkable patients don't put their energy into the things they can't control. They put their energy into things that they can, right? So they don't worry about, they don't grasp at, is my cancer going to come back or not? Am I going to die or not? It's like they're so living in the present moment that that's not an issue for them. And the second thing is that Bernie talked about self-love and self-care, that many of his patients, society's perspective is they were so busy taking care of other people that they weren't taking care of themselves. And so I started to see these patterns in the literature. Bernie was the first one to introduce it to me about how people can facilitate their own healing. The next book I want to talk about was actually written in the early 90s by Alistair Cunningham. And so he's a research scientist who runs the Healing Journey program at the Princess Margaret Hospital. And he really delves deep into the kind of spiritual side of care and so on. But he did a prospective study. They measured people who on average were estimated to live for about a year. And he looked at how much self-care, how much psychological and spiritual work they did. And what he found was the people that were highly involved, who did the meditations, did the journaling, really took their healing journey very seriously, they lived 3 times longer than those who were the least involved in the study. And he even had a couple of patients who were alive and well 20 years later, metastatic breast cancer to bone endometrial cancer that had spread elsewhere. And so again, he was identifying this, doing the hard work makes a difference. And what Alistair found out was that his patients did well if they followed the A's. And the A's are authenticity, meaning they listen to themselves and are not pushed by societal norms or even the suggestions of their families. Secondly, that they're able to truly accept. And that's actually one of Bernie's major points as well, the acceptance piece. And I'm not going to go into all of that, but the point was to be able to accept the reality of your situation as you are right now, as your starting point, right? To accept and take action. So it's an and both phenomena, being comfortable in this present moment and aspiring to grow, to get stronger, to heal, right? So was Alistair's, some of Alistair's major points. So that was also inspiring. And then the next major influence was from about 2014. And in the meantime, the neuroscience, the brain science was then proving what you and I know to be intuitively true, which is our thoughts, our attitudes, our actions influence the kind of psychological and ultimately the physical aspect of our bodies. And so there's all this brain science I want to introduce into the program as we go. But Kelly Turner, who's featured here in a book, Radical Remission, she's a PhD scientist who essentially interviewed people who have undergone spontaneous remission throughout the world. And her, like I, don't agree with the word spontaneous. And it's not spontaneous because in some sense, these people actually did some work in order to kind of help facilitate their remission. And whether it's over a short period of time or a long period of time, she called it radical remission because they made radical changes to their lives. And so we're starting to explore this. Well, how is it then that you can really unleash that healing potential within your body? And that was essentially her qualitative research and the source of her book and the recent docuseries. And she's also released a book recently called Radical Hope. But I just want to let you see the 9 key factors shared by the cancer survivors. And let me just move that a little bit over there. So I guess the takeaway is that people were really willing to take control of their health. They're willing to make the changes, take their healing journey very seriously. And when that happens, then what can you influence? You can obviously influence your diet and whether you're taking herbs and supplements. Just by the way, there's no one herb or supplement that actually is proven to help all cancers. But anyways, it's something that people can influence. There's the emotional work. There's the kind of connecting with others. And then what I would say is a kind of the spiritual side of it, having a strong reason to live, deepening your spiritual connection. So, and again, the people who had undergone spontaneous remission, you had all of these factors, or almost all of these factors in common. Interestingly, the 10th factor that didn't make her list, but she subsequently said is true, is that people exercise. They were kind of willing to kind of engage their body for healing as well. So we're beginning to see a pattern through this time. And then most recent, so this book was released, I think early 2020. Jeffrey Redinger is an MD psychiatrist who also went to divinity school in Princeton. And he had been studying, like from a scientific perspective, people who had undergone spontaneous remission. And again, he doesn't like the word spontaneous. And so he was beginning to look at it from a hard-nosed scientist perspective and a kind of bigger spiritual perspective. Well, what is it that people do, or how is it that they can facilitate this? And he has his 4 pillars of health. He says healing your immune system, healing your nutrition, healing your stress response, healing your identity. And that's a bigger spiritual question as well. Now, I don't think it's just kind of the immune system. I think he might be talking to something much bigger than just the immune system. I call it your body's healing capacity, your healing potential, right? When you heal your life in these other ways, when you facilitate healing through nutrition, when you work with your stress and have that healed in your life, when you do the deeper spiritual work, the psychological work, then that all comes together as the 4 pillars of health. And so again, I'll be featuring his work probably mostly during that last lecture, where I'm going to look at each of those 4 authors. But I'm trying to give you a perspective of, that I'm taking this from an oncologist who works within conventional system, who's had a 35-year journey now to try to figure out what people can do to facilitate health. And I've always that kind of the scientific paradigm. I didn't want to delve into the unproven, but I can definitely accept that there's lots of unknown here. And there's this human capacity to heal that I can't necessarily describe. I definitely can't promise it, but there's kind of the mounting evidence that there's something that's metaphysical, that's beyond just the physical stuff that I'm going to be featuring today. So back to our take-home points. So what is it that you need to take away? What is it I'm trying to teach you? And what do the remarkable cancer survivors do? Well, firstly, it's this integrative process. And you're trying to get the best care from within the conventional medical system, and you're adding to it, combining it with, integrating it with what you can do to empower yourself at levels of body, mind, and spirit. So it's the 2 together. Now, you may disagree with going to conventional care, but at least I'll share what I believe is the best side of this. Secondly, I would say you need to do the work. The remarkable cancer survivors, invest in their life, invest in their healing process. And I want to give you the practicality. These are the steps, these are the realms that you need to delve in. But it's not just like a harsh disciplinarian, kind of beating yourself into doing these things. It has to be done, in my mind, or maximize your chances, in my mind, if you can do it with a sense of love and peace. So you're driven out of not a sense of fear, but a sense of love, a sense of connection, a sense of manifesting the best within your spirit. And so you can do the hard work and, be in a much better space. And when you do that, I really believe that you can profoundly influence your physical health and ultimately your kind of sense of happiness or connection or meaningfulness or whatever you ascribe to being highest, whatever you value most. I think you can profoundly influence your health. Okay, so how are we going to do that? How are we going to cover that? Well, here's what I'm writing for you. So this is essentially what I call integrative medicine. What you need to do to really make a difference in your health and the happiness, and capture these in turn. So then I'd ask you, be conscious, be proactive. Ask yourself, what is it that you need to do? What is it? What's your outcome? What is your final goal? And that can be within a process, or it can be an outcome. What do you want to manifest in your life? And so, yes, we can think about maximizing your chance of recovery. And this is what I found for most people who've had a cancer diagnosis. They want to maximize their chance of cure. They want to maximize their longevity. So we can go for that. That's for certain. The second thing that most people want from a cancer journey, or I know through this type of program, is to feel better emotionally, right? There's so much kind of stress, turmoil, and unknown with a cancer diagnosis. Put that within the context of COVID, and people can feel just unwell psychologically. So how is it that we can feel better emotionally, more connected to our best self, and better able to connect with the transcendent? I'd also say that most people, and this is kind of come up in the last few years, they want to actually be able to function better. They want their brains to work better. They want to be able to do more of the activities love. They want to be able to translate the physical benefits into meaningful benefits through thinking better and functioning better. We need, and I think our relationships are probably the most important thing in our lives, so we can learn to connect more. And there's more kind of a science or methodology around that I'll be talking about in the subsequent seminars. And lastly, you can see a bigger purpose here. Is it that you want to grow psychologically or spiritually on this journey of life? Regardless of kind of cancer outcome, we can continue along that spiritual path. And so what is your goal? What is it that you want to manifest? What's the purpose of you listening to this talk? So I say that very bluntly and clearly at the start, because I think it's very important to set your intention, to think about, well, what is it that I want to manifest? How is it that I want to be in this world? And I'll just share you just a bit of what happens for me is, in the morning, it's usually my wife and I. This morning I happen to be meditating by myself, but I set my intention through a ritual. I sit quietly and I practice mindfulness. And more recently, I've been using a heart rate variability monitor. So it clips onto my ear and it kind of measures the stress levels within my system. And so by a slow breathing, long, slow, smooth out breath, and also a visualization of breathing through my heart and having a kind of this sense of gratitude, I can actually settle down my nervous system. So I'm practicing a relaxation technique, practicing meditation. I think that's extremely important. We'll talk about that later. That skill just by itself, and resetting what I call the stressometer, or the stress level within your life. So I'm doing that as the first technique for probably 10 minutes, maybe 12 minutes. And then I put my hands up into the air as a kind of a reception. It's like, and then I start to pray. And sometimes I use religious terms. Sometimes it's more secular, but it's like, please guide me, please help me. And I'm starting to pray about what I want to manifest. Please let me be helpful. Let me be clear. Let me be kind. Let me, my best self come forward. And so I'm praying hard around that. And lastly, I do a little prostration on the floor. So I'm putting my forehead down on the floor, my hands are up. And it's kind of a symbol to say that I'm not really in total control here, that I'm I'm willing to be the servant or the vessel or the instrument of something bigger. So of love, of peace, of joy, whatever it is that I aspire as highest, I want to be the vessel that comes through. So that's my ritual. And I'm hoping that that kind of philosophy and feeling will follow through the entire day. So I'll just put that in kind of words then. So then ask yourself, how do you want to live in this world? Describe your best self. When you're on your game and you're in good space and you're connecting with people well and you're happy, how is it that you, like, what are the attributes or the adjectives of yourself? So you're starting to describe the attributes that will also contribute to your healing. What do you want to manifest? What's most important to you? So I do that as a ritual, right? So I'm doing that first thing in the morning. You could also do it last thing in the evening with a sense of gratitude for whatever was positive within your life there and help you kind of go to sleep. So I set it as an intention at the start. And then walking into the difficult situations, recognizing, oh, this is tough right now. I'm about to go into a difficult conversation, or I have to talk with someone who's angry, or I have to work with a relative or friend who's not in good space right now. So you recognize, okay, remember what's most important. You know, you're going into a medical appointment, for instance. I want to get great care. I'm willing to kind of, advocate for myself. So you're remembering, again, going into a difficult situation, you're settling down the kind of nervous part of the nervous system, and you can kind of advocate for yourself. So practice that. And lastly, we're all human, which means therefore we will also sometimes just get flustered and stressed and lose it and so on. But hopefully at some point in that process of kind of being flustered and irritated and, feeling awful, you recognize, oh, I'm away from my home. How is it that I can kind of come back home again? So that's, again, something that you practice, a muscle that you get better at as the days go by. So given all this, so I set that intention, and then I'm about to offer you a whole bunch of different advice in terms of how it is that you can manifest this from a very practical perspective. How is it that you can integrate this pragmatically into your day using that attitude? Okay, so this is the integrative care piece. So the advice is coming. What's difficult is that there's no one best way, right? There is no one best route. You have to listen to your intuition. There's something within you that wants you to grow, that wants you to, be your best self and manifest at the highest level. It's almost like trying to listen to that to help guide you. The point is that we're all unique, right? We all have different strategies that work for different personalities. There are some kind of cancer heroes that like to fight and so on. And hats off to you if that's, what you like to do. Other people are very, very peaceful and kind of, not wanting to see cancer as an enemy. And so that also could work well for them. So different needs at different times. And I'd say throughout this, I'm trying to point you to something where you're using your rational, logical mind, getting the information, being wise and scientific about what's happening. And then also kind of when you get that information, trusting your gut, saying, yes, something within me wants me to pursue that method. It feels right. I want to go there, right? So we're using both sides. So at the very highest level, we want to get information. It's like being in the back of an airplane as it's taking off, that kind of rumbling feeling. It seems like it's a long time and it's kind of a little bit nerve wracking. Well, it's a different view from the control tower. We can see how fast the plane's going at there. You realize the plane's taking off about halfway down the runway. You want to empower yourself and be clear thinking and pragmatic here. So I'd say learn to speak the language of the medical system, right? Because it is powerful in ways that they can offer treatment and options in your journey. So you want to be able to speak the language, know what you can get, what you can't get, increases the sense of control, helps you make better decisions. But also, when you're listening to this talk right now, there are lots of other ways that you can empower yourself and make a huge difference in your health. And so this information is the starting point, right? So empower yourself. Lastly, this is such an important point. Learn what you can control and what you can control, and then let go of the things you can't control. It's like one of my patients I saw many years ago. She had a breast cancer and had a young son, and she talked to me and she said, I don't pray to God to be cured of my cancer. Even though I want that to happen, I pray to God to be given the strength to face whatever arises. And again, being able to be very clear thinking, so you're not spending your energy and your worry in things that can't influence your health. Okay, so how about Layla, can we do a quick mute of whoever's on making some noise there? Maybe just go through the list. Thanks. Yeah. So how do you get that information? And I'm going to say this at each step in the way, be open, like the hands are open to the universe. How can you be guided? Well, I'd say find the expert, right? There's always an expert, whether it's nutrition, exercise, information, and there are different sources of information. Some of the cancer centers have libraries. Maybe you have to email your nurse. Canadian Cancer Society offers a very excellent service that you can really tailor the information to your level. So cancer.ca, or you see the 188 number here as well. And the slides will be available after this talk now. I'd say also go to not-for-profits within your cancer type, because oftentimes they have really good kind of summary information. The issue is there's so much information on the internet. You need to kind of focus to know that you are getting the valid and important information. And lastly, you're here in this talk in order to learn more, but you can network with other people, whether it's in chat rooms, et cetera, et cetera. And you're not gonna take every bit of advice. You're gonna listen to what's the quality of the advice, what's the quality of the source they're talking about. But that networking, figuring out how the medical system works and however else is how you do that. Okay, I'd say as well, a big perspective is that we can often feel overwhelmed with too much information. And so if you're feeling like it's tiring you or it's becoming an obsession, then definitely you need to kind of step back a little bit and keep things in balance. If you're finding conflicting information, I'm always going to point you back to your physician, your cancer specialist, who understands the nuances of your situation and can give you advice that's tailored to you and what you need to do. Ultimately, I'd like you to come to a space where this is feeling like, yes, I'm doing everything that I can do. I'm on my right path right now. And I can kind of relax into that. And yes, you have to keep your ears open still and need to continue to advocate for yourself with time. But it's just that kind of space of, I feel good. I feel right about what's happening right now. So then how do we get the best care from the medical system? And this is going to be the subject of the next webinar, to kind of completely flush that out. And I'll also talk about complementary medicine. But ultimately, you need to kind of learn how the system works. You need to develop a strategy that works for you as a person and your family member, your teams, and really learn the nuts and bolts of what you need to do. And that will actually make a difference in your accessing the care there. So develop a strategy. Through that, you really need to prepare for your appointments. You need to, get the first level information so you can speak the language of the medical system, get your questions written down, come prepared with various information that you need for them. So that's, again, this is the 20-minute talk that's happening next time around. Remember that you are the most important person in the cancer center. The system's there to serve you. And it's that kind of feeling like, yes, they're here to serve me. I need to advocate for myself. If there's a problem, an issue, I keep going until I get as good an answer as I can get. And recognize that they're human beings, that with their personalities, and to recognize that you need to kind of work with that limitation in some sense as well. So, and lastly, you have certain responsibilities. You need to know what to do, when to do it. And so you need to learn your responsibilities and then ultimately deliver on those responsibilities. So this is a very important piece of the big puzzle that maximizes your chances. I mean, the fact is the medical system's putting in billions and billions and billions of dollars working on new research, new treatments, et cetera, et cetera. So there's always the hope that they can, get you that home run that we're all after. Okay, and the last one is the remarkable cancer survivor is willing to advocate for themselves, right? Again, if you're the most important person in the clinic and you feel that your issues are not being addressed, how can you advocate? Well, what's the mechanism and that symbol to say my health is so important that I'm willing to do that. Okay, the quick summary of complementary medicine, because again, I'm presenting it next time around, is that really, if you can make a huge change in your life and maximize your healing potential and your chance of recovery by doing the healthy habits and the things that don't require you to take extra medications and costly treatments. I really think it's not necessary, but at the same time, I'm not going to dissuade you from doing that. So start with the healthy lifestyle choices. Do your research. Again, be logical. What's the risk? What's the benefit? What's the proof? What's the quality of proof that the recommended treatment, recommended complementary treatment is something that you should follow? Again, being pragmatic about it. Tell your doctor what you're taking, especially if you're taking something by mouth or IV. And lastly, I would say, don't forego the proven treatments to follow something that's complementary. Give the medical system the due at the start. Okay, so that's the quick summary on the complementary medicine side. Okay, everybody, you're in the midst of this video. If you can just stand up just for a moment, I think it's worth just a little stretch there. Maybe a little rub of the tummy. Be very kind to yourself. Maybe look away from the computer screen for just a moment. Right, so we're kind to ourselves. It's a kindness that allows us to maximize the chance that we're going to heal. Okay, empowering the body. So we're now getting to this next phase. Get the best care from the medical system. You investigate complementary side if you want to. We're going to break it down into what do you do to help your body heal? How is it that you release the that healing potential? How do you get your immune system to work better? And I honestly believe that our consciousness has an influence as we think about our body and consider our body with a sense of gratitude, that this is the vehicle that allows me to connect with others. It allows me to reach out and give a hand, or to receive a hug or give a hug. When we put ourselves into that space of this remarkable vehicle, this remarkable organism that has this capacity that allows us to be conscious, that attitude has an influence on the healing potential of the body. In addition, you can say, well, this is an organism. How is it that we create the conditions for this organism to thrive best? Does my body need to be exercised? How much sleep do I need? So it becomes then pretty obvious that the attitude of loving your body with a sense of gratitude, a sense of peace, sense of kindness can actually influence not only your behavior, but the consciousness influences the body itself, puts you in a better space if you want to see it pragmatically. So exercise. I can't emphasize this one enough. Even if, you're very weak, just even getting out of bed and stretching and doing those things, our body has the ability to respond. There's a huge amount of data that it releases the happy hormones when you stretch the core muscles, or use your core muscles or some type of exercise. Actually releases a kind of sense of what they call the joy molecules. It also motivates you more to take care of yourself, to reach out to others. And from my perspective, it's a symbol of I want to get better. I want to heal on the journey. Okay, so I've shown you a picture here of one of my patients. This is 10 years after I started treating Derek. He had a very aggressive prostate cancer that we were going for cure. And he was running a business at that time. And he took me up on it. I said, Derek, you're going to get hormone treatments. You're going to have these side effects of treatment. The best thing you can do is to exercise. So he started going to the university gym, which you were seeing in the background there. There's my wife. We're there for a prostate cancer empowerment program. And he took it whole hog. You know, he started going 6 days per week. He began to know all the people in the gym himself. He was doing Tai Chi. It's just a lovely story. And now you see him there 10 years later. He's age 87. So I treated him at age 77. His PSA's super low, PSA blood test super low. And he's still lifting weights and still in great spirits and pointing to the various people in the gym and telling me about their lives a little bit. So exercise, exercise, exercise. We'll talk about how that can happen, but it can be as simple as turning on the your favorite YouTube video or song and kind of dancing in the kitchen. Okay, number 2 is diet, right? A huge way to have an influence. Incredible. I just didn't understand this. You know, I've made a huge jump in the last year or so. Again, because this is known to be one of the key factors, get the expert advice, talk to the nutritionist, do your research. Ultimately, you also want to listen to your bodies. If I'm going to summarize this, eat food, i.e. not chemicals, mostly plants, not too much. That would be the overview. Like a nice little picture in the bottom corner of the slide there. Your body will help guide you. But you want to do a little bit of experimentation. I've changed to being a vegan in the last 8 months. It really made a big jump in my strength and just overall fitness. What I'd say, avoid or reduce, especially red meats. They say meats, sweets, dairy, and refined food. Put eggs on that list too, actually. Excuse me. I'd say this has to be plant-based, really. Yes, you can have the occasional meat. I'm not going to stop you from having some healthy white meat, but the plant-based diet is the antioxidants, mops up the chemicals that are causing the damage. And not only that, there's something else that is even more important that I'm understanding is the anti-inflammatory. Right? When you eat the foods that irritate your gut, it releases the chemicals that causes inflammation in your body. You don't want inflammation. A, your immune system doesn't work as good. B, the cancer cells keep getting hits on them. And C, you just don't feel as well. You have less energy. So the anti-inflammatory, that's a kind of a key principle within exercise, diet, and so on. Low glycemic means that you don't want your blood sugars to be spiking up and down. You want kind of the blood sugars to be in a nice, healthy, normal range, kind of staying there throughout the day. So that's having the protein with the meals, healthy fats and fluids. So this is a whole talk by itself. Super important. I'll take you through the steps of the healthy diet. And lastly, the supplements that you need. Definitely everybody in Canada needs vitamin D at least 10 months per year, 1,000 to 2,000 international units. And if you're a vegan, then add the B12 onto that. So diet, maintain a reasonable weight. If I could offer advice around this one is be kind to yourself. Using kind of the guilt factor around this is not the best way to make the change. And I'd say throw away your scale. It's not a number that you're after. You're actually after that kind of energized feeling, your body's kind of feeling strong and healthy. And so I would take all these guys in the gym here who are working out, regardless of their weight, over the 20-pound less version of them who is not working out. So this exercise is more important than an absolute number. Sleep, super important. We're going to talk about how is it that you can create the conditions in which you're likely to sleep better. Right? Again, you're taking care of yourself. It's this wonderful symbol. Practicing relaxation, right? So this is resetting your stressometer. And so whether it's through, a kind of mindfulness breathing technique or a body scan or a yoga. It's one of those techniques where you're recognizing that your mind's chattering and you're bringing yourself back to that kind of centered, calm state. And it's a practice over and over and over. Super important in terms of immune function, your mental health, your cognitive ability. It's all the above in terms of practicing relaxation. So we're gonna actually include that in the subsequent seminars. Okay, so I moved out of body, and now what we're going to talk about is the kind of power of the mind to heal and to release that kind of healing potential. And so stress and working with stress and seeing stress as the healthy aspect of yourself is one set. Reframing difficult thoughts, transforming emotional energy, because we humans are going to run into scenarios in which our emotional energy can really flare, anxiety and so on, frustration, anger. So how do we work with that to change that into healing? We're going to talk about some self-compassion. We did a little bit of setting the intention. So again, this visualization there. And then doing the deeper psychological, spiritual work is super important as well. Okay, the levels of stress training. So this is, again, I'm just giving you the broad brush of what you need to kind of work with stress. So resetting your baseline stress level is the relaxation technique part of this. You're setting your stressometer. It's you're delving into the well of stress reduction because your brain practices that every day. You're going to settle down when you get suddenly flared or triggered. How is it that you can kind of return to your normal? Understanding your relationship with stress, right? Stress is not all bad. That stress is actually enhancing. You can draw on that life force energy. So understanding that stress can be helpful just by itself is a transformer. So we're going to teach you how to do that. And ultimately, we're going to work with the core beliefs that are the source of your stress. If you can let go of your struggle with reality, then you're going to feel a lot less stressed. So that's the training around stress and stress reduction held it all at once. And I put it on this curve. So you can see that as you get more and more and more stressed, in the bottom right-hand corner of the screen, you can see you've really lost it and you're not going to function very well. And so as we practice stress reduction, we go up the curve. But ultimately, I want to teach you how to get to the upper curve so that you can be under more stress, but still functioning at a very, very high level. I'm just going to give you a quick introduction of reframing the difficult thoughts. This comes from David Byrne's book, and it's also called Cognitive Therapy, or CBT. And I'll just take you through a very quick example because he uses a 3-column technique. So you see the situation up top, and then oftentimes our stressful thoughts cause us more distress, so we can work with them in the second column. And ultimately in the right column, I don't expect you to be able to read this right now, so I'm going too fast for you. But ultimately, it's the wise and compassionate part of yourself that can see the reality, see a bigger picture, can be encouraging, can acknowledge the difficulty, and just a real sense of kindness and encouragement. So that's the step 3. And I'll just take you through a very quick example to put within the context of COVID. So you have a cancer diagnosis and you're self-isolating. So that's the reality. That's probably the smart move to do right now as you're in the midst of cancer diagnosis. But then you say to yourself, this is bullshit. I'm stuck inside and can't do anything. My life is wasting away during COVID. This is totally unfair, right? So not only are you in a difficult situation, you're self-isolating and feeling, more disconnected, but then you're talking this up and kind of catastrophizing it. And if you can see yourself, causing yourself that emotional turmoil and the anger and the frustration and how you exaggerate, ultimately you can work into the right column and you can talk to yourself in that kind and wise way. And that would come out as acknowledgement, looking at a bigger scenario and being encouraging. So how does that come out verbally? Yeah, this is frustrating, but it doesn't help to focus on my limitations. I can do things which fulfill me. This is a chance to focus on the good things and the love in my life, right? So despite a difficult situation, you're reframing in a way that makes you feel better and function better. You're more likely to pick up the phone and connect with somebody at that point. Okay, so just maybe 5 more minutes or less of this this talk before we get on to the Q&A. So this again this is the introduction. We are going to have difficult emotions. And so if you're like flash angry at a situation, you look at, the source of that emotion. And yes, maybe you're angry. Sometimes you do need to kind of stand up and say, don't do that, or, withdraw yourself from the situation. So the anger has a purpose, but sometimes we exaggerate or distort. That person shouldn't be like that. They shouldn't do things. People shouldn't be this way, et cetera, et cetera. And so oftentimes it's our core beliefs that are adding to the extra anger. How can you honor your emotions? Sometimes it's like frustration around, what's happened, or kind of going through the grief. So it's okay to grieve. It's okay to have the difficult emotions, give those emotions their place, but don't necessarily hang on to them. So, and ultimately, to what degree can you let go of some of the underlying stuff that's causing the emotional disturbance? So we're going to take you through that step by step on a subsequent talk, but that understanding can really help with the emotional transformation so that you're in that positive, happy, proactive space, your best self more often. Doing the deeper psychological work. So I'd encourage you to consider this is an opportunity. A cancer diagnosis is an opportunity to look at the most difficult stuff there, right? And Kelly Turner in her Radical Remission says, releasing suppressed emotions, oftentimes that's childhood suppressed emotions. And then ultimately you can even work at increasing your positive emotion. I'm not saying be happy or put on a false mask. It's almost like creating the conditions in which you are happier. How is it that you need to do that? Give yourself that luxury. So whether it's journaling or seeing a therapist, and so many other techniques of delving in and releasing any sense of those tensions. Forgiving others, right? Holding those grievances is not helpful. I'm not saying what they did is okay, but because you're detracting from your own health when you're doing that. And then also forgiving yourself. So that's the deeper psychological work. And I'm just going to finish with, I'll just give you this quick little self-compassion technique, because this is, I think, really important as well. And I'll just step you through it. So if you can think of a situation in your life that's causing you stress, and you call to mind, you can see yourself actually feeling distressed and so on. So this is normal. This is what happens to us human beings. And so when you see yourself feeling upset or frustrated or whatever distressing moment that is, you can say to yourself, this is a moment of suffering, right? So it's kind of a mindful acceptance. Or if you don't like the word suffering, it sounds too dramatic, you say this hurts, or ouch, or this is stressful. And remember, listen to how my voice is speaking. It has a kind of compassionate, soft, reassuring quality. So you say it's a moment of suffering. This hurts. Number 2, you say something, suffering is a part of life. This is what happens to human beings, or other people feel this way. I'm not alone. We all struggle in our lives, right? So that's just the truth. We all are struggling. And then number 3, you can put your hands on your heart, and just kind of that sense of connection, that sense of gentleness, that sense of caring for yourself. And then you say to yourself something like, may I be kind to myself? Or lots of other ways to say that. What do I need to right now to express my kindness to myself? Or may I give myself the compassion that I need? May I accept myself as I am? May I learn to accept myself as I am, etc. So may I be a strong. So you can actually practice this as a small break in the middle of the day. It helps kind of with the emotional transformations. I just want to say that connecting with your loved ones is an important part. You still need to take care of yourself. So you invest and you take care of yourself. Please ask for the help from others, right? And offer it at the same time. We're very human in that way. Find a wise person to be your confidant, someone who can just listen. We're going to go through that. Create the culture of an open vulnerability. And ultimately, you want to care and love others, because when you're in that space, that is your best self. I can't summarize the kind of transcendent perspective other than to say that there's something, an observer consciousness that holds our lives, that's bigger than ourselves. And, you know, when we begin to kind of release into that, it puts the transformation goes from kind of my pain to the pain. This is what happens to us human beings. And this kind of sense of observer consciousness has a very peaceful and very loving quality to it. So that's part of ourselves. We're both the individual and we're part of something much greater. Okay, so I think it's question and answer time. I'm going to stop the share here, and we'll put up this slide at the end as well for everybody's interest. So I thought I'll stop here, but then go into the questions and answers section of this. First question was, what do you mean by spontaneous remission? And the definition for most people is somebody who has a known like condition or medical disease that's been proven scientifically. So for instance, if they have a cancer, they have to have a biopsy in which they look underneath the microscope and, you know, an expert says, yes, this is definitely cancer. So that's the first thing. Secondly, they have to have not had any other type of treatment. Like, so whether it's an experimental treatment through the medical system or any type of other thing. So the kind of medical system has been exhausted and they're not getting anything else. And the third thing for a spontaneous remission is that their kind of tumor shrinks away, their cancer shrinks away, and they're healed. Like they've kind of got the home run of, you know, becoming completely better. And it's usually over a marked period of time as well. So it has to, and that was Dr. Jeffrey Redinger's criteria for talking about his spontaneous remissions. He wasn't talking just about cancer, but it had to be, you know, the person did something outside of some type of experimental therapy or the medical system, and it was incurable and not expected to do well, and yet their cancer went away. The slides are going to be available. Yep. So someone's talking about a special type of treatment, whole body treatment, and they have multiple myeloma. Multiple myeloma is a blood cancer that typically is thought to be incurable. And they're talking about, you know, the treatment itself can compromise the immune system. The immune function doesn't work as well, doesn't fight off infections as well. And they're saying, isn't that the opposite of the list of the diet? So the point is that we do need a strong diet to help us know every aspect of our body. Every cell that's metabolizing needs nutrients, needs not only just the kind of energy and the sugars and the proteins and the fats, et cetera, but they also need the micronutrients. So, so even though the chemotherapy or the systemic therapy may be, you know, decreasing the immune function, you still need some immunity, and you still need to kind of feed the healthy immune cells so that they can do their job. And, you know, just literally you need energy for your body to function, for your brain to work, et cetera, et cetera. So the diet that I'm outlining there has multiple functions. And it's not just the immunity, it's like everything. So great. Thank you. Thank you. Okay, so I'm going to read another question there that's kind of coming privately. That person says, my biggest concern is the fear of dying, but not the fear of dying, but the fear of leaving behind and not enjoying what I've worked so hard for, right? What would be some good readings as to have done the self-compassion? I have love and connection, but I'm still missing the understanding that we are more than our physical self. So yeah, so you're really kind of asking a question around the spiritual part of this. And I really think that, you know, that book, Love, Medicine, and Miracles is Bernie speaks to something that's much bigger. He's such a good storyteller about people who've undergone spontaneous remission or radical remission and how they've changed their lives. And then you start, the way he tells the stories is like, how could that be happening? There has to be a bigger something that's kind of contributing to that. And so I'd recommend Love, Medicine, and Miracles just by itself. Bernie's, he's just a wild character who's kind of tapped into that bigger spiritual picture, and he puts it in kind of interesting forms. The other one is Kelly Turner's book, Radical Remission. She has a whole chapter, on deepening your spiritual connection is one of the chapters, and having strong reasons for living, again, is another one. But and spirituality is not necessarily about religiosity. It's like something, understanding there's something bigger than oneself, just as at a first level. So, okay, yeah. So, audience question: could you further describe the earpiece device that you use as a stress management tool? Okay, so the name of the organization is the Math Heart Institute. They've been doing scientific research for the last almost 30 years now. And so they've developed this device called a heart rate variability monitor. And essentially it clips onto your ear, and then it usually comes out as an app on your phone. And so essentially what the app is doing, this little monitor biofeedback system is doing, is measuring your heart rate, but it's the distance between the heartbeats and how much that varies. So for instance, let's say your heart usually beats about 60 beats per minute. Well, you don't stay exactly at 60 beats per minute throughout that whole minute. You actually go down a little bit to like 59, 58. And then as you breathe in a bit more, it goes a little bit faster, 61, 62. And the more variation, the more you kind of go up and down and vary around the kind of baseline heart rate, the more your body is in a coherence between kind of mind, emotions, and kind of the physicality of the body. So it's essentially, it's measuring heart rate variability, and it's also measuring something called coherence. And so it's giving you kind of every 5 to 10 seconds, giving you feedback as to what level of stress your body's at. And so it's an easy device that can help teach you how to relax your body. And that particular device has been proven to help with like high blood pressure, diabetes, post-traumatic stress. Like there's lots and lots of data show that by teaching yourself that relaxation technique, using that biofeedback monitor, people actually recover faster from those type of illnesses. And so we've been actually using it in our prostate cancer empowerment program, and the guys are, 6 months later, actually teaching their brains to change, which is a whole other question there. Okay, yeah, what a great question this is. So are there ways I can quickly catch myself reacting negatively to stress? Yeah, so this is the human condition, right? Because we are all going to feel stressed at different times per day. And we all have different triggers, and we all have different ways we kind of react to the stress. And so part of why it's helpful to practice meditation or mindfulness first thing in the morning or last thing at night is that you get stronger and stronger at the muscle of recognizing when your thoughts are kind of getting, you're starting to fantasize or think about the past or perseverate or catastrophize. You kind of recognize that your kind of thoughts are, getting you carried away. And when you recognize, oh, I'm thinking about this one other thing, I'm not really focusing on my breathing, you bring your attention back to your breathing again. And it's that muscle. It's like that recognition. Oh, I'm thinking about something else. When we recognize, we can return, and the muscle of returning is what you are getting stronger and stronger at. So as you practice meditation, this will kind of permeate through your life such that when you're in conversation or things are happening, you're better able to watch yourself. You're better able to watch your physical, oh, my gut's, getting a little bit achy, or my jaw's getting a little bit sore, or, oh, geez, I'm feeling irritable, or, oh, did I really think that about that person? So you're able to kind of have this ability to watch yourself, and then that will allow you to see when you get stressed, when you start to lose it. And then obviously, the earlier that you can recognize, oh, I'm getting stressed and flustered, the easier it is to settle yourself down as well. So the point is, it's a practice, and that by practicing mindfulness and like taking a mindfulness-based stress reduction course, you can get really much better at recognizing what your stress reaction is, intervening earlier, and then really being able to settle yourself down faster. Now, you're not going to get back to feeling completely calm, but it's the better self that will respond to the situation. I hope that's helpful. I mean, that's a whole it's a whole mindfulness course that is helpful on that side. Okay. Yeah. So this is a really question. Thanks, Krista, that you're opening from the heart here. So I have metastatic breast cancer and 2 toddlers, right? So metastatic breast cancer is an incurable cancer, and yet you're a mom to 2 little ones. How do I navigate the guilt of spending time on self-care when I just want to connect with them and make memories? Yeah. So the difficulty is, it's always a balance, and there's always going to be tension, right? There's always going to be this tension of, I need some quiet time in order to, feel better and, keep myself centered, et cetera, et cetera. And the tension of wanting to spend, that wonderful motherhood time with your toddlers, right? And so there's always going to be this back and forth. Sometimes I say to people, it might be easiest to see that the self-care time, the time where you kind of recharge your batteries, will allow you to appreciate your little kids more, right? And so give yourself that quiet time, because you'll be a better mom and you'll appreciate your kids more. So, I mean, it's an easy and trite answer to give, but just to recognize that it can be very stressful, or that kind of sense of pressure to try to maximize the amount of kind of life lived, and that kind of letting go a little bit and just saying, I'm just going to relax into this a bit more, can take some of the pressure off of working in those circumstances. So thank you. Thanks for that's a really tough question and a really tough situation. I really appreciate the kind of honesty coming through that. So thank you. Okay, another question was, I will be cancer-free, with quotes, for 3 years next month from stage 3 breast cancer. And I'm finding that I'm more stressed now, worried about recurrence or a new cancer. Will these techniques that you're discussing still be helpful at this stage? So the answer is yes. Yes, 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 yes. So again, I just acknowledge, this is the human condition. This is what happens with people with stage 3 breast cancer or whatever else. So stage 3 is a higher risk of having the cancer come back, but this person still, hopefully will be cured of their cancer. And what I've noticed sometimes is that the most stress is just after the treatments are done. So you go through your big surgery, your chemotherapy, your radiation, suddenly you're released home and you're having to go like, now what do I do? And so I call it the post-treatment meltdown, which is a normal thing. And I don't want to diminish, this in any way or form, but oftentimes going home and trying to get into the new normal is the stressful part of life. And yes, it can persist for a few years. And yes, those anxieties can kind of flare, good months, good weeks, bad weeks, good days, bad days, et cetera, et cetera. So this is normal, right? As you practice, as you decide to choose life, to choose love, to focus your energy and attention on the things you can control, the anxieties will just lose their power. Now, they won't necessarily go away completely. And yes, they can flare at times. It's normal to flare at times, but they just won't flare as often or as much. but this is all normal. This is all expected. And we don't have to struggle against being how we are. So that's the acceptance piece. The acceptance piece is 3 years later, I'm feeling more anxious. So that's your starting point. So we start fresh from there, and then we start this healing program. And then that's the answer to the question, is that you really can make a difference in terms of transforming the anxiety into, your life force energy and doing things that really help. So I'm really hoping you'll stay with us on that one. Thank you. See you next week. Layla, have I forgotten any questions here?
I think there was one question earlier. It's, if I don't seriously undertake the hard spiritual work, how accountable and responsible should I be for my health status?
Yeah, do you know what? So this is one of these scenarios where do what feels right for you, right? So even though I'm offering this kind of spectrum, and because I'm personally interested in the kind of spiritual hard work, just because I'm interested doesn't mean it's right for you. But so this, I almost see it as kind of levels. So the levels are, how can you help your body heal as a number one, right? That should be the kind of groundwork for everybody. So if you can get your physical body stronger, like the physical stuff will influence the mental health and your brain function. So do that for certain. And then we're human beings. We have a psychological makeup. How we think and feel and act through a kind of mind level can also be influenced. So I definitely recommend that work to whatever degree feels good, whatever feels right for you. And whether you want to add the spiritual piece to this, which ultimately influences the mind piece, which influences the body piece, it's totally up to you. So I don't want to push my beliefs onto anybody. Do what feels right. You have something within you that you can rely on that will really help you guide your journey. And maybe that's a wonderful spot to stop, because that really is applicable for everybody. I'm happy to stay on the line for, even a few minutes. If you guys want to do like verbally, we'll stop the recording. If you guys verbally want to chat with me, Layla, you okay with me chatting with these guys?
Yeah, I'll just do a quick outro first, and then we can stop the recording in a second. So just on behalf of CCSN, I'd like to thank Dr. Rutledge for his organization, the Healing and Cancer Foundation, for collaborating with us to produce this series. This is one of many webinars that we have scheduled this fall, and you can find all the information about our future webinars on our website. And you can also find recordings of previous webinars as well as the slides on our website. And we'll be back in 2 weeks on Wednesday, September 30th for the second webinar in the series, Getting the Best from the Medical System.
And complementary care. Yeah, I'm going to change the title a little bit. So,
okay.
yeah.